Hi, Dr. Brian Mills from Mountain View, California, and welcome to Exocad for the Restorative Dentist. Today, I'd like to review intraoral digital records. I'm going to show you a very easy, accurate way to get your digital records efficiently so you can create your digital patient. I'll be using a Trios 4 intraoral scanner, and at the time when I recorded this, it was one of the best scanners. As with all technology, if you haven't bought an intraoral scanner, I recommend that you go ahead and research the most current intraoral scanners because technology changes and improves. So with that being said, let's get started.
Hi, Dr. Brian Mills from Mountain View, California, and today I want to be demonstrating the digital records that you'll need to be able to begin creating the biostatic digital patient. So I have a Trios scanner, and I have my patient here, Sandra, who'll be volunteering for us. And so let me just set her back and we'll get started. So I recommend a Trios scanner. It's one of the most accurate scanners, and it has a fast capture speed and a large capture box. So it stitches the frames together quite well. You always want to make sure, just like a regular analog impression, that the patient has debris free. And then I go back and I just do a little dry here. Open for me, Sandra. And we'll start on the bottom and do our scan. Basically, when you're scanning, you want to go reasonably fast, but not too fast. The articles show that you don't want to go too slow and you don't want to go too fast. So the speed I'm going, which will end up being about a minute for this arch, is the proper speed. Okay, that's a good scan. Same thing, you just want to dry the tops of the teeth, make sure there's no saliva in approximately or on the occlusal surfaces. And you want to make sure you get the palate, and you'll see why when we actually mount the case in Exocad. You'll need the palate so you can make sure that it's properly mounted. Okay, and that's the top one. For the occlusion, we're going to need to do an open bite centric mounting. And to do that in the digital world, we're going to fabricate a little anterior discluder jig. I happen to use Beauty Fill composite, and all we're going to do is just take a little bit of this, and we have a 1 millimeter visicryl cutout that we're going to use to create a flat landing zone for our patient. Kind of put it on top of the tooth like this. And then you hold this really straight. You just want to flatten it and then drag it back. What this does is it fabricates a little custom deprogrammer you can use, especially at the first patient records visit where they probably have tight muscles, don't have a stable condylar position. Now when she bites down gently, you're going to ask that patient come forward a little bit and all the way back, and forward and all the way back. And you can coach your patient to say, put your fingers right here, Sandra, go ahead and put your fingers up here, and open and wiggle your jaw. Can you feel your jaw move? Mm-hmm. Now close gently and then slide forward. Feel it come out of the socket. Mm-hmm. Now let it go back. Feel it go in the socket. Mm-hmm. So that's where I need to record it. I will need to record that pivot point. So when I say let it relax back, that's what we're doing. Okay? And close and come forward and all the way back. And just hold, close, and swallow. And does that feel comfortable back here? Mm-hmm. No stress or strain? Mm-hmm. Great. And then just gently open and close. Now I'm not putting any pressure on her. I'm just checking that she's hinging. Open and close. Go forward, back. And she's landing in the same spot every time. So what you'll want to do is take some flowable and just put a little bit of material right there to lock it in, so when you scan her bite, you make sure she doesn't move. And that's the sound you want to hear. And just do the other side. And you can double check this. Open and relax and close. Great. And open. Now you can keep this jig as your VDO jig for when you're doing your digital CPI.
If you found this interesting and helpful, please give it a thumbs up and also subscribe. And if you'd like further information, go to biosthetics.com. This is Dr. Brian Mills from Mountain View, California. Take care.